CUPE is sounding the alarm over staffing levels in hospitals in Ontario and says things will get worse unless big changes are made. CUPE and the Ontario Council of Hospital Unions says a survey of 750 members shows nearly half dread coming to work and about the same number are considering quitting. The union says the government needs to develop a solid plan to attract and retain healthcare workers that involves better pay and reduced workloads. And for more on this, I'm joined live now by registered nurse, public speaker and advocate Birgit Umaigba. Birgit, it's great to have your perspective on the show as a frontline healthcare worker. So thank you for this conversation.
Thank you for having me, Elena, and Happy New Year.
Happy New Year to you as well. I want to go through some of these findings with you, Birgit. As we noted, 41% of Ontario's hospital workers say they are dreading going into work. Nearly half are considering leaving healthcare altogether, and 79% of hospital workers in Ontario say they're not confident the Ford government will be able to improve conditions within the healthcare system in 2024. Is any of this a surprise to you?
Not at all. That's no news at all. And we do know that for the last 3.5 years, nurses have been calling and sounding an alarm that we are short-staffed. And I think as of last year, there was a projection that Ontario will be short 33,000 nurses as of 2028. And we do know that we're not graduating nurses as fast as we need to. Ontario has always had the lowest registered nurse to population ratio in all of Canada. And a new report from the province's fiscal watchdog as of 2022 revealed that the Ontario government needs to spend $21.3 billion more on healthcare to meet its own expansion targets. So this is no news.
This is not news, you say, not a surprise. I'm hoping we can take a look at what this crisis is doing to the people who are working in our hospitals every single day. You have been working at various locations for years now. We heard one of the speakers at Queen's Park today say healthcare workers are crying before their shift. They're crying in the middle of their lunch breaks. They're crying after work. And that 44% of workers are having trouble sleeping. Does that resonate?
Absolutely. I've heard from nurses during lunch breaks say they've had to start taking pills just to be able to sleep. And these are new grad nurses,
Wow.
nurses that are barely 2 years into the profession, and then the burnout among the nurses who've been working for years is just widespread, and it's nothing's changing. And right now, nurses are just really tired of repeating themselves and saying the same thing. There's no investment in public healthcare workers, especially nurses, and it's devastating. Nurses are being traumatized from being overworked, understaffed, underpaid. Nurses who work in emergency departments have been physically assaulted. There's barely any support available to these nurses. I've actually heard nurses say that some of their employers have asked them what they could have done better in such situations, despite working understaffed. So it's traumatizing to those who continue to work in such challenging situations.
We heard CUPE talk about solutions at Queen's Park today, talking about significant investments, looking for $1.25 billion investments annually for up to 4 years to help the healthcare system as it grapples with this crisis. What do you think of that plan, and what more do you think can be offered in the form of solutions?
There needs to be robust investment in publicly funded healthcare. We do know that the Ontario government has underspent in public healthcare while expanding privatization. There needs to be a shift. There needs to be an investment in public healthcare. There needs to be a system that allows nurses who are still in the profession to stay, because retention has always been a problem and has continued to be a problem. And also the fact that we do have internationally educated nurses in Ontario that are unable to practice. Just yesterday, I was supporting an internationally educated nurse to find a job at Walmart, right? So we do have nurses, but nurses are leaving. They're leaving for the United States. They're seeking greener pastures. Nurses are not able to pay their rents. They're not able to afford homes anymore. So people are going to places where they are most valued and they're well paid for the work that they do. And unfortunately, Ontario doesn't present to be supportive to nurses at this point. So we need serious investments
Right. And for anybody who's listening to these alarming stats, who is not in the healthcare sector, listening to the fact that so many healthcare workers are exhausted and they want to leave, and many of them are losing sleep over this, and we're dealing with the staffing crisis. Are you worried, Birgit, very quickly, about how this might impact patient care in hospitals?
Of course, absolutely. Depending on where you work, I work in critical care, and I'm sure nobody wants to be looked after by an exhausted nurse who actually hasn't slept or is on pills to stay awake, just to be able to titrate the life-saving medications or to be able to operate a ventilator. I don't think anybody wants that. And the fact that nurses are seeing heavier workloads, heavier assignments, and we do have new grad nurses that are being thrown in difficult terrains with very little support, because the overworked nurses who have been in the profession for years, for decades, are retiring early or they're quitting altogether. So it is having an impact on patient health, on patient care, and everybody should be alarmed, because the next victim could be you or myself.
That is concerning for sure. Birgit Umaigba, thank you so much for your time. Really appreciate this.
Thank you so much for having me.